Hey, I'm Nichola Gaither, a veterinarian at the Animal Hospital of Statesville, and today we're going to talk to you about heart disease in cats, how it's diagnosed, and how it's treated. Our clients have questions about this, and my assistant Kyle is going to read off some of those questions to you.
So, do I need a board-certified cardiologist to diagnose heart issues in my cat?
Good question. Sometimes we do. Cats can be very confusing, and sometimes it can be hard to detect heart disease in them. So we do rely on our veterinary cardiologist, but also the general practitioners like myself are able to help with that as well.
So how do I know, or what would I see in my cat to suspect that he or she has heart disease?
Your cat might be lethargic, so they may sleep 25 out of the 24 hours instead of 23. Sometimes they don't show any symptoms at all, which is why the physical exam at least once a year is important for your cat. But your cat may have shortness of breath or open mouth breathing would be some symptoms you might notice.
Okay, and how are heart murmurs in cats diagnosed?
Heart murmurs are diagnosed basically through listening to the heart by a stethoscope.
Okay, what does an echocardiogram show that an x-ray won't?
X-ray is basically a two-dimensional view. It's a big picture, a still image of the chest, and the echocardiogram is a specialized ultrasound of the heart. And so that way we can look sort of at the inside of the heart to be able to determine exactly the underlying condition of the heart.
So if a cat has heart disease, how long can the cat expect to live with that?
Good question. So murmurs in cats sometimes are not clinical. Even though we hear a heart murmur in a cat, it doesn't necessarily mean that they have bad heart disease. So it depends on the type of heart disease they have, but several of them can live many years and have a good quality of life.
So what heart conditions are considered treatable and which are not?
Good question. One of the big diseases that cats get is cardiomyopathy, hypertrophic cardiomyopathy, which is basically enlarged muscles of the heart that don't flex very well, and that is hard for the heart to pump blood. And so when that happens, that can be life-threatening for some of our cats.
Well, those are the main questions we get asked. If you have any other questions of your own, please give us a call. We'll be happy to answer them. Thank you.
Thank you.